All right. Good afternoon, Minister. Welcome. I've already connected with everybody. So again, we'll
Recording in progress.
just go through the questions as we normally would. I'll call on the outlets to ask their question when ready. And then just to begin, I'll just pass it over to Minister Jones. Welcome. If you'd like to say a few words before we get started.
Thanks, Shannon, and my apologies for being a few minutes late. I was actually in Mississauga with Premier Ford, and we were celebrating some success in the pharmaceutical space, a new head office location in Mississauga. So my apologies. I know that we want to talk, or I hope we want to talk about an exciting announcement that I was able to make last week, and that was an expansion of primary care practitioners, multidisciplinary teams in particular in the province of Ontario. So with last week's announcement, we have 78 either new or expanded multidisciplinary teams, and that really just means teams of combinations of clinicians. Could be nurse practitioners, could be physicians who are working together in teams with registered nurses, perhaps dietitians, mental health workers. And this is all about because it gives better service to patients. So I use the example of when Mrs. Jones goes in and her family doc or her nurse practitioner tells her that she has diabetes, right in the same organization, there is a dietitian, a diabetes educator who can walk that patient through what it means for their lifestyle changes and what they have to do in preparation. So I'm really excited about the expansion, literally across Ontario, 78 new or expanded primary care multidisciplinary teams. And with that, Shannon, I could go on for many, many hours on all of the investments we've been able to do in terms of accessing care. You know, in January of 2023, so just over a year ago, Premier Ford and I announced an expansion of pharmacies, allowing individuals to go to a pharmacy to get treatment for 19 minor ailments. And I am pleased to be able to tell you that that one change has meant that over 700,000 Ontario residents have accessed primary care for those 19 minor ailments. There's some really exciting pieces coming down through the Ministry of Health, through Premier Ford's leadership. So I'm happy to take any questions, and I'll turn it back over to you, Shannon.
All right. Thank you. So, well, first question, I'm going to go to Sarah with VIP 51.
Thanks, Shannon. Hello, Minister Jones. The government is investing to add over 400 new primary care providers to close the gap and help the residents who are not connected to primary care. However, some newcomers may not be able to find their family doctors near where they live. So my question is, how can the government make sure those primary care teams are located in the communities that need them most? Thank you.
Yeah, great question, Sarah. So we sent out an expression of interest, which really was if you as a provider or a community or an organization would like to see an expansion or a new service in your community, show us what that would look like. And that expression of interest went out last May, June. And it's actually taken us this long to basically do the assessments. And a really important piece of that was to make sure that we were placing these new or expanded clinics in parts of the province that really needed the extra primary care providers. So you will see many of them. I will give a couple of examples. In Sault Ste. Marie, Northern Ontario, two have been awarded there. In Kingston, we have one submission. That means 10,000 people are going to have access to a primary care multidisciplinary team. So part of the assessment approval process was to look at the current needs within the community and match that with the organizations that submitted proposals.
Thank you.
All right. Thank you. Next, I'm going to go to Teresa with Correa de Mana.
Hello, everybody, and thank you, Minister, for the opportunity. We know that many people rely on walk-in clinics because family doctors don't accept new patients. We know of people in Barrie, for example, that have to go to Toronto because they can't get primary care physicians in the city they live in. So my question is, will this investment, this recently announced investment in primary care, help people in this situation?
Absolutely, it will, Teresa. So the examples that you gave truly highlight why, when we initially made this announcement, we actually tripled the dollars that we put forward in expanding the primary care multidisciplinary teams. In Barrie, in particular, there is a satellite that is now going to be able to be expanded into the Innisfil area. So real concrete submissions that say, if you give us these additional funds, we will be able to serve that many additional more patients. And, you know, the reference for walk-in clinics, it's one of the reasons why we did the pharmacy expansion in January. We felt that, and the numbers have now shown this, that when you give people the opportunity to access service in the most convenient, close to home area, like a pharmacy for 19 minor ailments, you know, most of us as mothers, we know what pink eye is when we see it. We just need the treatment for it. So that piece has, as I said, been really well received. We have over 5,000 pharmacies in the province of Ontario, and the vast majority of them, 94%, have offered this service to their patients and their customers.
Thank you so much.
All right. Next, I'm going to go to Kala Salama, My Second Home TV. Oh, Kala, you just need to unmute there.
Thank you, Shannon. Mr. Jones, how concerned should be Ontarians right now, especially when the special report on CBC that was broadcasted, I believe, 2 days ago about measles? This is really concerning, especially it shows that there is a lack of vaccination with certain kids. And the other question is, with the influx of asylum seekers not vetted, and also we have no clue about what kind of vaccination they have, how this will impact our population here.
Yes, a really important and topical issue. We, of course, have heard of our first case of measles, and that is very concerning. We have worked directly with Public Health Ontario and our public health providers, the local public health units, and said, you need to refocus your efforts on, in particular, childhood vaccines to make sure that we catch up from some of the lag that happened during the height of the pandemic. So the focus has been very much on that. But, you know, again, it speaks to, if people don't have access to a primary care practitioner, it's very hard for new parents to understand where their children are in terms of vaccines and which ones are needed when. So tying it back to this announcement, I believe that this will be one effort that will improve and get us back to where we need to be in terms of vaccination rates and childhood vaccinations in particular. Our schools are also a really important partner to keep up to date and have parents and submit where their childhood vaccinations are. But really, we need individuals to be tied to a primary care team so that they can monitor that and assist with the vaccine.
And with respect to the unvetted asylum seekers, especially, they don't have any vaccination cards like we did. What's your plan, Minister?
Well, we have actually funding and pathways for refugees to be able to access OHIP covered services in the province of Ontario. That will continue. Look, we need to make sure that the federal government and the provincial government have very clear line of sight in terms of how many are coming, where they are coming, so that we as a province and as a Ministry of Health can be prepared. But those pathways already exist, in particular for refugees in Ontario. Thank you.
Okay, perfect. Next, I'm going to go to Tarandeep with PTC Punjabi.
Thank you so much. Thank you so much, Minister Jones, for giving me this opportunity. I am Tarundeep Singh from PTC Punjabi. And my question is, can you provide more details on how the 110 million investment will be distributed among the primary care teams in Ontario?
Yeah, thank you, Tarandeep. So as I said, we are rolling out we've announced the total investment and the total number, and over 300,000 people we expect to be able to be matched or connected with a primary care team. And then individually in communities across Ontario, we have local members of provincial parliament who are announcing the expansions within their own community. I don't think I'd get them all done if I had to do all 78 announcing, but the local MPPs have been communicating with their successful recipients and are making local announcements, and you're just starting to see those now. I highlighted a couple in Sault Ste. Marie. I believe there's a half a dozen in Toronto that are all expansions. Of course, in Kingston, one application should mean an additional 10,000 will be matched with a primary care provider, and that one in particular in Kingston, they've already acquired the lease and they're ready to go to do the hiring. So it's an exciting time for as we expand across Ontario.
And my second question is, what specific criteria were used to prioritize areas of greatest needs for the expansion of primary care teams?
So there were a number of data points that were considered when we looked at the application. One was how many unattached patients would you be able to serve with this expansion, and looking at what the unattached rate is in the community in the region. Another piece is how quickly can you get these up and running, because it's really important that the proposals that were put forward weren't going to take years to ultimately get and open their doors. Access to, what is the Health Human Resource Plan for recruiting new practitioners? Do you have a plan, and do you have candidates that you believe are ready to sign if you get it? So there were a number of pieces to make sure that we were reaching the highest number of people as quickly as possible.
Thank you so much, Minister Jones.
All right. With that, I'm going to go next to Nitin with Prime Asia TV.
Thank you, Shannon. Hello, Minister. This is Nitin from Prime Asia TV. Minister, medical assistance in dying. So now federal government, they are in favor of including for the expansion, they want to include mental illness under the MAID program. Whereas the opposition party, federal opposition party, they are opposing it. So being a health minister, so what are your take on this MAID inclusion of is that good, that inclusion of mental illness should be there or not?
So I believe that, so I'm going to start with the federal, provincial, territorial ministers of health met in the fall of last year, and we discussed very specifically this expansion into mental health and access for MAID. We did not agree with it. We did not feel that the time was right. And you can see, so as a result of those conversations, we actually wrote to the Federal Minister of Health and said, please do not proceed with this expansion. And then I want to talk about, my preference is, as a Minister of Health, that we offer treatment, that we offer hope. There should not just be one pathway, and that is to access medical assistance in dying. So you will have seen through a $330 billion 10-year commitment from the province of Ontario that we're expanding access to mental health and addiction services. We have now 22 youth wellness hubs in the province of Ontario that didn't exist under the previous administration. Those have only begun since Premier Ford in 2018. And we are seeing really positive outcomes where individuals under the age of 25 have access to mental health and addiction services and a touch point so that they know where they can go when they or their loved ones are in need. We've expanded the number of mental health treatment beds in the province of Ontario. In my own community, we have a highly regarded residential treatment facility that is now serving more young people who have been battling mental health and addictions, often concurrently. So I want the investment to be treatment. I don't want it only to have through a pathway of medical assistance in dying. And Premier Ford has reiterated that very clearly in the last number of days when asked by the media.
Minister, my follow-up is, since Canada's population is rapidly growing very fast, and we have seen that our doctors, they are serving the patients, and doctors are also fatigued out, they are stressed out. And also newcomers or the Canadians now, they also don't have a family doctors. So what action we can take to serve our doctors so that they should not be stressed or fatigued out? And for the newcomers, what message you have for them?
So we've done a number of pieces, and I always say, government shouldn't just look at one thing, one and done, we call it. So obviously, last week's expansion of primary care multidisciplinary teams is a huge step to make sure that more people have access to clinicians. The other piece of it, and you've touched on it, is we actually need more healthcare workers in the province of Ontario. So when I was appointed as Minister of Health in 2022, within months, I wrote a letter of direction to both the College of Nurses and to the College of Physicians and Surgeons of Ontario. And I directed them to deal with their wait lists. There were people who were waiting to see if they could get a license to practice medicine in the province of Ontario. Those two letters alone, those two directives, have led to the highest number of nurses who have been registered and licensed to practice in the province of Ontario for 2 years running. So a very successful push to say we need to make sure that people get assessed and ultimately licensed when appropriate. On the physician side, we've made quite a investment in, of course, new residency positions, seats in our universities, our medical schools. And because we know that we have such a need on the family physician side, we've set aside 60% of those new seats for family physicians. So every Ontario medical school in the province of Ontario has at least 20 new residency positions available. And the large ones like Queen's and Toronto and McMaster, in fact, have over 50. So that's another piece where we're growing domestically our number of students who can access and want to practice in the province of Ontario. The other piece I'm really excited about, and we're starting to see very positive uptake, is again, working with the College of Physicians and Surgeons of Ontario, who ultimately does license nurses and in that case, physicians. We have now gone in a space, historic, first time in the province of Ontario, where internationally educated and trained physicians who were practicing or did their education in the US, the UK, Ireland, and Australia now do not have to go through an additional financial and time burden step of physician-ready assessment. Again, over 1,000 internationally educated and trained physicians were licensed in the province of Ontario last year. So we're seeing great interest. You know, my line is, I don't believe that we need to actively recruit. People love to come to Canada. They love to work and raise their family in Ontario, but we need to make sure if they want to practice medicine and if they want to work in health human resources, we smooth that pathway as much as possible. We're not done, but progress has been made.
Thank you, Minister Jones.
Okay, so next I'm going to go to Rami at Oxygen Talk Show.
Thank you very much, Sharon. Thank you very much, Minister Jones, for this opportunity. I have one question concerning the seniors that come here to meet with their families, and their insurance cannot give them more extensions, and they need medical assistance. Some of them need nurses, and the cost is very high. Are there any programs government of Ontario make for those seniors who come to join their families and now the insurance cannot cover this cost?
So are you referring, Rami, specifically to home care? So
Yes,
yes,
maybe home care, nurses and such stuff is needed. Many of my audience ask about this problem, and they cannot extend the insurance.
yeah, so specifically related to making sure that we have sufficient home care services in the province of Ontario, we have, through Minister Bethlenfalvy as Minister of Finance, under Premier Ford's leadership, in last year's budget, we set aside $1 billion to expand home care specifically in the province of Ontario. We know that in order for people to be comfortable and be able to stay in their homes, sometimes they need a little bit of assistance. And our home care providers who are out there are excellent, but again, we need more. So one of the programs that we have been able to successfully roll out is to pay for and fund the education of personal support workers, PSWs, very successful in making sure that we have sufficient PSWs working in our long-term care homes and in the home care setting, specifically as it relates to nurses. Again, a program under the leadership of Minister Dunlop at colleges and universities. We have a Learn and Stay program in the province of Ontario. And what that means is nurses, lab technicians, and in Northern Ontario, paramedics who want and wish to train as those healthcare clinicians actually get their tuition and their books covered in exchange for working for a period of time in communities that need that additional service, so underserviced areas. Those programs are have been rolling out in the last year and a bit, and we have seen a great deal of interest on individuals who perhaps for any number of reasons, you know, we're worried about not being able to cover the tuition, so we're not choosing those education pathways. We've opened that opportunity up to them. So I'm really excited to see those nursing students and lab technicians out in our communities very soon.
Okay, we'll have to move on to the next question. So we'll go to Hamareen with Punjab TV.
Yeah, hi. Thanks, Shannon. Pleasant afternoon, Minister. Minister, as per the recent survey that was conducted by the Ontario Medical Association, it was said that 40% Ontario's doctors are considering retiring in the next 5 years. Given that fact, the situation seems to be very alarming nowadays because there are many reasons to it. We see that The life has been affected badly due to some physical reasons, mental factors, environmental factors, psychological factors. Given that fact that the doctors seems to, take retirement in the next 5 years, and also the situation, especially youngsters, are getting affected mentally these days, how does the government plan to take up this issue?
Well, it's exactly some of the initiatives that we've talked about. Our government, a progressive conservative government, increased medical seats in every Ontario medical school. The previous government, I have to say, cut residency positions by 50 in 1 year. That single cut of 50 seats in 1 year means we have 200 to 300 fewer physicians practicing in the province of Ontario, training in the province of Ontario. So policies do have an impact and make an impact. And by increasing the number of residency positions, we will be able to prepare for, frankly, a continuing aging population, a continuing influx of new Canadians wanting to live, work, and raise their family in the province of Ontario. So we're preparing through those pathways to make sure that we have sufficient clinicians working. We have also very actively engaged in removing some of the barriers for internationally trained clinicians in particular. Again, we see that there is a desire and a wish for people to come and live in Ontario, and I want them to come with those skill sets to be able to use them here, as opposed to waiting for endless months and years of maybe yes, maybe no. Process, assess, and ultimately license when appropriate. The other piece that I haven't talked about this afternoon is in legislation last year, we passed as of right. And as of right rules means that any physician who is practicing in Canada, in any other Canadian jurisdiction, can move to Ontario and begin to practice immediately while they await their license through the College of Physicians of Ontario. So all of those pieces together are really showing that our government is committed to making sure that as physicians retire or take a lesser patient load, we have people ready and willing to step in and cover their patients.
Okay, thank you. Next, I'm going to go to Gurpreet at Y Media.
Thank you. Good afternoon, Minister. Gurpreet from Y Media. My question is more in towards the accountability for the investment as well. Like, how do you plan to measure the success and effectiveness of these investment, and what tools or benchmarks you will be using to track the progress which we are making in healthcare?
Yeah, it's a great question, Gurpreet. So each of these organizations that have successfully received the go-ahead to do an expansion or a new have to sign accountability agreements with the Ministry of Health. And part of our responsibility is, you said that you could take on 10,000 unattached patients, as an example, the Kingston model. We will be monitoring that very closely. And the funds do not completely flow to an organization until they have secured location, until they have hired staff. So there are many steps along the way that we can make sure what they committed to and what they signed through an accountability agreement actually come to fruition and people see improvements.
Thank you. Just a follow-up.
Actually, Gurpreet, if you don't mind, I have one more person that wanted to ask a question. If you have a follow-up, would you be able to send it over to us and I can have it answered?
No problem. Thank you, Shannon.
Okay. Thank you so much. I am just going to call on Abhishek at Parvasi. This will be last question, as the minister does have to hop off for a briefing shortly.
Thank you, Shannon. Hello, Minister. This is Abhishek from Parvasi Media Group. We wanted to ask you, at the moment we have been reading that healthcare professionals are overburdened, and that has been one of the reasons that they are considering to move from the profession or We have been seeing reports that they're moving to US. On one hand, we are calling more immigrants, we are welcoming more immigrants, but at the same time, do you think that the workload on the media professionals has become such that it's very concerning? And also, the second question is about the Brampton Civic Hospital. I mean, very soon it could be a possibility that we might reach to 1 million mark in population, but still we have no clarity over the Brampton Civic Hospital. If you can please provide an update. Thank you.
Yeah, thank you. So I'll start with the first one in terms of stress and workload. There is no doubt that as a clinician, as a physician, as a nurse practitioner, if you know that there are people in your community who want to be attached to your practice and you just can't do it because of capacity, that would be a very stressful place to be. So the expansion has been very well received in the practitioner space. The other piece is related to the Brampton Civic and hospital capacity in general. I'm going to talk about some of the successes and talk about what we're doing moving forward. During the pandemic, we were able to add a 3,500 new hospital beds across the entire Ontario hospital system. And that was work that hospitals did, working with the Ministry of Health funding to make sure that any possible space that they had, they could make sure that that was available for hospital beds and for patients. Of course, the other piece that I'm sure you've heard Premier Ford and others talk about is we have over 50 capital expansions in, again, hospitals across Ontario. And that could mean a new hospital, that could mean an expanded hospital or a renovated hospital. And from everything that I've been told, that is the historic highest number of infrastructure expansions that we've seen in the province of Ontario. There are many, many worthwhile projects, not of course, and not the least of which is happening in the Brampton and Peel region for need for additional capacity. And we're working very actively with those MPPs and our friends at Infrastructure Ontario to make sure that we can add capacity where it is needed most.
All right, thank you. So that will be our last question. If there was anything that wasn't answered, please feel free to email me and I will get over to the minister and we'll definitely get your response on that. So with that, I just maybe wanted to pass it over to Minister Jones if you had any final words, and then we can log off.
Thanks, Shannon, and thanks for moderating this. I hope it was helpful. I hope that I was able to share some of the very exciting things that we are doing within the Ministry of Health to expand health human resources across Ontario. It is an exciting time to be in government and to be in the ministry as we see all of these different policy changes, expansions, investments bearing fruit and coming to a community very close to you. Thank you.
All right, thank you. Have a good afternoon, everybody. Take care.
Thank you. Bye.